I'd like to take you on the bus with me and great state of Iowa. Thank you very much. Yes, sir. Yes, ma'am.
I have a question. About the idea of having mandatory individual health insurance for Americans, and how that would how would that answer the universal health care issue?
First of all, I don't believe that it should be mandatory. I think Americans have choices. Now, I believe that there should be a situation where if someone experienced a catastrophic illness, that obviously we would provide some kind of way for that catastrophe to be taken care of. I think it ought to be affordable. I think it ought to be available. And if someone chooses not to take advantage of an affordable, available situation, then I don't think we can force them into it, or should. I don't think as a society. I think we have an obligation in our society to provide that to seniors or to all Americans, but I don't think we should mandate it. And that is one of the differences between me and the Democrats' proposals. And could I mention to you on the issue of the S-chip? As you know, the S-chip was designed to take care of children who are without health insurance. And it's done a pretty good job at that. There's still several million children, however, who have not been signed up. The majority of those children, they haven't been signed up because we haven't been able to contact them and to sign them up for the program. Now, there's a couple of million others that there's other problems with. But now we're going from basically a program that's going to be expanded, was going to be expanded by $5 billion to a proposal to expand it by $35 billion. Now, my friends, the reason why I voted against the Medicare prescription drug bill was because, one, it encompassed everybody. Why should you be paying for my prescription drugs? I vote myself pay raises all the time. I should be able to take care of it. Okay? It was designed for people who were low income, and yet we expanded it to everybody. And what we did was we laid an $800 billion to $1 trillion unfunded liability on the next generation of Americans. I said, we've got to stop that. We can't continue to lay this on next generations of Americans. So I favored a Medicare prescription drug bill for truly needy people who were somewhat above the poverty line. So now here we are. We're going to expand it. They want to expand it by some $35 billion. Now, do you know how they're proposing to pay for it? This is why you got to watch people in Washington. They're going to pay the additional $35 billion by, guess what? Increasing the tax on a pack of cigarettes by $1. Okay, so now we're going to provide health insurance for children, but we want them to smoke. What? It's just not right. It's not right. And by the way, they will never, ever get that kind of money out of increasing taxes on a pack of cigarettes. You're just not going to do it. So I had to get that off my chest. It had nothing to do with the question that I thought I would mention. Thank you very much. Yes, sir.
Senator, having recently had an MRI, it was of interest to me when I received the bill, and I found out that really I saw three tiers of cost. There was the cost the HMO wanted to pay, the cost that the company who did the MRI was asking for, and the cost that I ended up paying and making up a little bit of the difference between them. I also suspect there's a fourth level, which is what Medicare would have paid. I don't see how this plan on the insurance would take care of that root cause of controlling the cost at the service level, because the insurance premiums are going up as well due to those costs.
The insurance premiums are going up, obviously, because the costs are going up. And the costs are going up because maybe you didn't even, for a couple of reasons. One of them is maybe you didn't need that MRI. But maybe it was prescribed for you because the doctor is practicing defensive medicine. Maybe it's because we really need medical malpractice reform. I was in Nevada in 2004 We met with a group of OBGYNs who were all leaving the state of Nevada and moving to California because they couldn't afford their malpractice insurance premiums. What I would hope that is that there would be sufficient competition amongst these caregivers, that there would be realistic costs for them, and second of all, if there is a situation where you are covered for the entire year, that you pay a certain payment for the entire year, and the insurance company takes care of the entire year, and that's just part of your treatment for that year. In other words, a quality outcome, rather than next time you go to the doctor and he says, well, you know, not only need an MRI, but you need a CAT scan. And you not only need a CAT scan, but you need da-da-da-da-da-da-da. And then those costs pile up for the insurance company or Medicaid or Medicare, and then obviously the costs continue up. If we're going to keep the costs under control, if I gave you $2,500 and $5,000 for your family, and you went and shopped around for your own health insurance policy, I think you'd be more careful the next time you went to see the doctor. And I think that if we had clinics, I forgot to mention this, if we had walk-in clinics, that would have a tremendous effect. I think people in this room know very well, where's the highest cost health care in America? Emergency room care. That's the most expensive health care there is. Now, you have a bad cold, you call up your doctor, and the doctor says, I can't see you for a week. So what do? You go to the emergency room. Why don't we let Walmart or somebody else, whatever it is, have a walk-in clinic where it's manned by a doctor? You walk in and you say, hey, I got a bad cold. The doctor there sees you, gives you the medicine you need, and you go home. That would have a huge difference. That would make a huge difference in healthcare costs, my friends. And by the way, they are springing up all over America. We just ought to encourage them. So my answer to you is that they have all these different cost levels, and some of them artificial and some of them right, and some of them depend on where you live, some of them depend on what hospital you go to. That is a, it's such a Byzantine system that nobody understands it. To say, okay, we're going to take care of Joe Smith for this year, and we're going to give him a policy that he pays a certain amount for, and we'll pay the insurance company, we'll pay the medical people, providers at the end of the year, depending on what kind of shape he's in. Yes, sir.
Senator, according to Medicare and Medicaid, CMS, the Commonwealth Foundation, and a number of independent studies, Iowa offers the highest quality health care in the nation. We also are reimbursed at the lowest rate in the nation.
So you are penalized for being good, right?
Well, I think we were penalized long ago, maybe before we were this good, but nonetheless, the same procedure in New York and California is reimbursed at a dramatically higher rate with worse outcomes than that procedure here in Iowa. And since you are currently visiting the best community hospital in Iowa, so could we hope from a McCain administration to finally equalize the disparity in Medicare and Medicaid reimbursements?
I would do that, and I think the only way to do that is, as I said, is to reward quality and success and to penalize failure. And that means that if you have a patient, particularly with a chronic disease, heart disease, and that person undergoes treatment, we'll give you a certain amount of money to do that. And at the end of the year, it depends on the quality of the outcome, which obviously would advantage